All right, everyone. Well, let's just get rolling today. Thanks so much for joining us for this Lamplight lunch. My name is Brittany. I typically go by Smash. I use she, her pronouns, and I am the Congregational Engagement Manager at the Night Ministry. And we have been hosting these monthly discussion series called Lamplight Lunches. And each month we look at a different topic that intersects with our work at the Night Ministry. So it's a way for us to get to know more about the things that are affecting our clients and our work. And it's also a great way for us to kind of spotlight some of the really important, awesome work that our partners are doing. And today we are really excited to talk about overdose prevention sites, which obviously has a deep impact for our clients, particularly our clients that we see with our health outreach. So we are excited today that we have some folks joining us who are from the Community Engagement Project that was recently done. They're full of information, and I'm really glad that they're joining us here today. And I am going to let them introduce themselves. So Lou, Sue, Lee, would you please tell us who you are?
Sue, do you want to go first?
Yes, why not? I'm Lou Sice. I'm Director of Outreach for the Westside Heroin Opioid Task Force. And as of today, right now, I have a team of 5 people that's doing outreach right on Madison, Holman up to Albany. And this is, we started in 2019, originally with 2 members, and we've expanded that. And we started as a lone organization. And right now we're collaborating. We're in the outreach with about 8 agencies. So that's been a big plus for us to be able to work with other agencies that provide other resources and information for the clients in the community. So I'm director and hoping to be around to be able to train some younger person to take over in a few years, a couple of months or something like that. Hey, Lee. Yes. Thank you.
Go ahead, Sue.
Hi, everybody. I'm Sue Pickett. I am with Advocates for Human Potential, and I have the immense pleasure of working with Lee and Lou on the Community Engagement Project on Overdose Prevention Sites, or OPS. I'm the evaluator, so I'm the one that collects the information and tries to summarize it and keep us on track.
That's for sure. And I'm Lee Rush. I'm the director of the task force. I've known and worked with Lou. We co-founded Prevention Partnership 36 years ago. And I learned everything I need to know about how to work on the West Side from Lou, and I still do. And he looks at me to put it on paper. And we have a great partnership and really excited to doing this. The Prevention Partnership was asked to be the coordinating agency for the West Side Heroin Opioid Task Force. In the chat, I dropped the heroin and just use opioids because we don't know if there's much heroin out there. It's mostly fentanyl and analogs. But great to be here. The Community Engagement Project is one of the things that we're doing. The outreach piece is really, as Lou said, going great. We counted on Night Ministries as being our partner almost from the get-go, and that you guys bring great services. And we have some alumni from other organizations, Night Ministry alumni, and they bring their intelligence and experience from Night Ministry into their own organizations, and I think they're transforming them to be better focused on how to deal with things on the streets. So anyway, great to be here.
Thanks so much, y'all. Really appreciate the work you're doing and glad that we can collaborate on this as well. I do want to mention that we are recording this. We typically post it publicly afterwards. I like to tell folks, though, at any point, if you want to ask a question or talk about something that you don't want to be public out in the world, I'm happy to edit it out. So please feel free to ask hard questions, be as vulnerable as you like in this space, and then we have that option as we go forward. So we're going to get started today with a couple of questions. And first, the big question is, what are overdose prevention sites? And then maybe talking a little bit about what they might look like here in Chicago. So Sue, can you tell us a little bit about that?
Sure, and let me share my screen. All right, well, as the evaluator, you know, I can't do anything without a PowerPoint. I can, but it makes it a lot easier if we use that. So I want to tell you a little bit about how this project came to be, what overdose prevention sites are, and what we're trying to focus on in the project, and sort of what we know so far. So back in January of 2020, which seems like light years ago, Governor Pritzker signed a new executive order that was really focusing on the state's commitment, renewing their commitment to ending the opioid epidemic. And one of the things that was in that executive order was the fact that there are a lot of major racial disparities in the opioid crisis. I think everybody here knows that, so that's no new information, but especially on the West Side. So one of the activities to come out of that executive order was, what can we be doing to target this really high fatal opioid overdose rate in Chicago, but really targeting the West Side? What can we be doing to reduce overdoses and save lives? So an overdose prevention site, for those of you who haven't heard of this before, it's a new term. You might have also heard it as safe consumption sites. So they're legally sanctioned health facilities that let people use drugs that they obtain prior to coming into the facility. So they're bringing them with them. And they use those drugs under the supervision of trained staff. So nurses, social workers, maybe a doctor, but it's just, you know, with somebody who is observing them. And an OPS has a lot of benefits. It gives people a clean place to use. People can, you know, are using under trained staff. So somebody can step in with naloxone immediately and stop an overdose. It's a harm reduction model. So conversations around treatment and medical care and recovery services often happen within an OPS. Those linkages happen as well. OPSs have been found to reduce public drug use and loitering, and also reduce the infectious diseases. And the other thing that if Director Jones from Super were here, he would tell you, remind you that of all the studies that have happened in the past 20 some years of OPSs in other countries, there has never been a fatal overdose that's happened within an OPS. Why would I not behaving here? Sorry, folks. There we go. Okay. So what we're trying to do in our project is, you know, you say overdose prevention site, I'm going to put this place in your neighborhood where people can come in who are using drugs, and we're just going to plop it in so everybody be happy. Well, we know that's not true, right? So it's very controversial. And it is really critical if an OPS is going to be successful that the community is in support of it. So in order to even just start thinking about having an OPS on the West Side, we need to be working with the community, engaging them on OPSs, right? So having discussions with them about what an OPS is, educating them on an OPS, but also providing opportunities to get feedback from the community, listening to their opinions and their concerns, what they think will work, what they won't work, what questions they may have. That's the whole goal of our project. And again, it's funded by Super and the West Side Task Force. So we've got several activities that we've been doing. We've got a local expert panel, and there are representatives from the night ministry on that group that is mainly social service providers, some state legislators, but they're actually our group that helps advise us on what we should be doing and reviewing some of the nitty-gritty aspects of our work. We have a community advisory group, people that participated in our focus groups, and other members of the community that are there to give us that feedback and really help us think about how we could be better engaging the community. We created educational materials last year. Sorry, the rain is coming and I have to close the window. For community members and for law enforcement, we can make sure you have links to those. We created a survey that we administer to people in the community to get their feedback on the benefits and concerns about an OPS. We've done focus groups. And then this year we also convened some Zoom events where we had colleagues in Canada talking about the role of law enforcement in OPS and how to engage law enforcement. And then also some OPS operators in Toronto who shared their experiences about how they got their facilities up and running. So the survey that I'll just talk about really quickly, maybe some of you have helped us collect this. It's available both in paper and online formats in English and Spanish. And again, really focusing on three main things. What do people think the benefits are of having an OPS on the West Side? What are their concerns or fears? And then what activities do they feel we need to do to address community members' concerns? So we collected 573 surveys, the majority in English, 19 in Spanish. And you can see here just the demographic characteristics of the people who completed a survey. So almost half and half male and female, more than half were African-American or Black. Most of the people are West Side residents. We've got 54% who actually are living or working on the West Side. Of those group, we have a third of the people from Austin, West Garfield Park, East Garfield Park, Humboldt Park, Glendale, Lower West Side also represented. 33% of our sample are people who use drugs. You'll see the acronym in the slides, PWUD. And the majority of those folks who said, I'm somebody who uses drugs, live on the West Side. And then the age range was 18 to, we think we had somebody who was actually a little over 100 with an average age of 49. So the first section of our survey looked at benefits, and the wild majority of people, 88%, said, yes, I think an OPS would be a good thing. It would be beneficial for the West Side. And you can see some of the comments here of people, why they thought it would be a benefit in terms of, helping people not overdose, saving lives, all those good sorts of things. We also, asked people about benefits, to ask them to rate their agreement with specific benefits. So again, you can see in the next few charts, these are participant responses to these potential benefits in terms of reducing fatal overdoses and public drug use and reducing HIV risk and other infectious diseases. Majority of people also felt that an OPS would make their neighborhood safer. It would reduce dirty needles in public spaces. It would reduce loitering. It would connect people to treatment, connect them to healthcare, and teach people about overdose prevention. So again, as I said, it was controversial. We want to ask about the benefits. We also want to ask about fears and concerns. So we had 22% say that they had some real fears about what an OPS might do on the West Side. So again, big concerns about drug selling, gang activity, bringing more people who are using drugs into the neighborhood and encouraging people to come to the neighborhood who are misusing drugs. And then again, we also asked people about their fears and their concerns. So hang on, I've just got to change my view here a minute. People away. There we go. Decreasing safety, decreasing their family safety, increasing drug selling. Bringing more people into the community, encouraging drug use. Other concerns that we asked about that the people had noted is that, that's going to drive more businesses out of the West Side. We don't have enough resources. Concerns about the police will watch the OPS and not our community, and increasing infectious disease risk. Now, while you do see that many people disagreed with these fears, it's important to note that we do have a percentage. We've got at least 25% to maybe even 30% who are expressing that they've got some real fears and concerns about having an OPS on the West Side. And I'm going to talk a little bit more about some of that we learned in our focus groups. And then the last part of the survey, we asked people for their opinions on what we could be doing to get the word out. How can we address these concerns? And, again, it's holding meetings, it's providing information on benefits, specifically how an OPS has helped communities like the West Side. So one of the things we do with the survey data is try to look at who says what and if there are differences between groups, because different groups have different opinions. And I think it's perhaps no big surprise that white participants who work on the West Side were more likely to agree that it would be a good thing, while Black residents who live on the West Side were more likely to disagree that an OPS would be beneficial. We also see that our Black participants, folks who were older, those who were living on the West Side, male participants, interestingly, people who use drugs, and then people in the Austin and West Garfield Park neighborhoods were more likely to say, nah, I'm not so sure about this, and to report more fears and concerns about having an OPS on the West Side. We also did 7 focus groups. We did focus groups with social service providers, business leaders, faith leaders, people who use drugs, residents, social service providers who work with West Side residents who are Latinx. And then we also did a focus group with CPD officers who worked on the West Side. So we asked all of the groups the same questions. We wanted to learn what they know about an OPS. We asked them about whether or not it would be a good thing and why or why not. We asked about benefits and concerns. We asked what we can be doing to address those concerns. We asked their opinions about who they thought would be in favor of an OPS and who would not. And we also asked them what we could be doing to share information about an OPS with West Side community members. So we then look at, in terms of analysis, what are some of the common themes? What are people saying across all the groups? So again, in terms of benefits, all the groups said that the biggest benefit of an OPS would be that it would save lives. Some other benefits that they talked about was connecting people to services, providing opportunities for people to stop or decrease their drug use, educating the community about opioids and substance use, educating families about treatment, addressing drug problems on the West Side, and helping to test for fentanyl. In terms of concerns, some of the common themes that came up is, where on earth are you going to put this? You know, what's the location going to be? It's got to be a place that people will use, right? If it's not something that people feel comfortable using, if it's not welcoming, they're not going to come and use this. So that was very important. It needs to have what some focus group members called a service legitimacy. So they talked about locating it within an existing healthcare facility or having it connected to an existing healthcare facility. We had, not a big surprise, a lot of people who have that old NIMBY, not in my backyard, saying, you know, I don't want it in my neighborhood, and people expressing concerns that it's going to drive businesses out of the community. A lot of people also asking, you know, why the West Side? Like, we have overdoses all over the city. Why the West Side? Why aren't you targeting the coast? And also, don't put it near a school. Other themes that came out was concerns about the police, right? So we want to keep people safe. We want to keep people in the neighborhood safe. We want to keep the staff safe. We want to keep people who are coming into the OPS safe, but you know, we're concerned that the police are really going to watch it and that they're going to target people for arrest. If they know people are coming with drugs to use the OPS, they're going to get arrested. How do you keep people safe? What happens if somebody becomes violent? The concern that it's going to bring more drug selling and gang activity into the community. CPD officers were also very concerned about safety and asking questions about, well, who's actually going to provide it? Like, we're really overstretched right now and we don't have the manpower to do this. So, you know, how is that going to happen? How are you going to train the staff? We're concerned we're going to get a lot of calls, that this is really just going to be a big stressor for us. So what are you going to do about that? The focus group participants also had some really great ideas about community engagement and who we should be educating. So educating schools and parents and students, sharing information with parent groups, educating the community about harm reduction. This came out in a couple of groups as well, is helping the community learn that abstinence is not the answer for everyone and that relapse is a natural part of recovery. And as a few people said, you know, we've got to do something to keep people alive and help them for when they really are ready to get treatment and maybe think about not using anymore. And we were encouraged to work with faith-based organizations and community coalitions as well. Another big theme that came out was really making sure that the OPS is part of the community. There was definitely concern expressed that, you know, don't make this something that you just plop down into the community and then the money runs out and, you know, it goes away. So really make sure that it's part of the community. hire people who are part of the community to do the staffing and to do the services. We don't, don't rely on the outsiders. We want people who are really invested in us to be here and to help us. And then in terms of sustainability, lots of questions about that. How's it going to be funded? Is it going to be another project that just leaves and goes away after the funding ends? We've got a lot of history of that here. It's not good. We've had lots of good things come and lots of good things leave. So how are you going to sustain this? Is this a done deal? Do we actually have a say in whether or not we want this in our community? As I said, we had the Canadians from some of the larger cities that are similar to Chicago. So Toronto, for example, having them come, this was a recommendation from the focus groups that we did. So have them come and do a Zoom and talk about what it was like for them engaging the community and some of the roadblocks that they ran into and how did they handle it. Also had recommendations to be collecting data on it from the very beginning. So we've got a way to measure success and look at outcomes and also look at, is it really increasing CPD calls? Again, CPD, big issue. How are we going to engage with them? Focus groups had some really great ideas about building those partnerships, stressing the importance of involving leadership in our planning activities, having a liaison who can help build those relationships between OPS and CPD. I mentioned before that we had a Zoom meeting where we had an officer from Canada who is really committed to OPS, who has actually offered his assistance and helping us with this. But, again, really what's kind of the next step is how are we going to make sure that CPD is on board and that we're building those good partnerships. We also wanted to focus on the needs of people who are Latinx. And so, people in those focus groups talked about the fact that we need to have bilingual staff and involving family, making sure that the services are anonymous and that people who may be undocumented feel safe and know that they're not going to be reported if they come in and use the OPS. Looking at other support systems and supporters that people who are Latinx may wish to involve. So again, family members, clergy, having them be volunteers and helping educate both the people who are using drugs and families about opioid use and naloxone. Just to kind of quickly wrap things up, this is, again, we started this work last year. We're continuing on. It's not a done deal. We need to keep sharing information and addressing the concerns about location, what it's going to look like, what the rules are going to be, how safety is going to be maintained, how it's going to be funded. There were also concerns about youth and what kind of message does this send to youth and will be available for young people to use. Looking for some champions to help support this, working on those relationships with CPD. And this is us. I think we've also put all of our information in the chat. And I think Brittany, we're going to turn it over to Lee. So I'm just going to stop sharing.
Thanks so much, Sue. That was a lot of helpful information and great to hear the feedback that is coming from the community. We know how important that is. One of the questions I have, and I'm assuming other folks have as well, is like how does something like this happen? I know we have sites like this across the globe, but not really here in the United States. So what has to change perhaps in terms of legislation, infrastructure, to make it so we can have an OPS here in Chicago?
Well, first of all, there's no legal OPS in the United States. I think the last one that got really close was in Philadelphia, and they won a case against the federal government, and then lost the case. And I think the community probably they didn't complete the due diligence with the community. And the community, I think, when they got really close, pushed back, or at least some people from the community. There probably are a number of de facto, non-sanctioned sites. I think a lot of the places where folks are, and probably a lot of your staff goes. There's kind of like a few people who know a little more and make sure that there's enough Narcan and et cetera. The most recent Well, first of all, let me just mention the reason why Canada seems to have a leg up on this, and the police are really quite enlightened. If you, hopefully, I can share that video. I was trying to find the link for it. I'll make sure you get it, Smash. Is that in 2011, the Supreme Court in Canada voted unanimously 9-0 that overdoses was not a legal issue, but it was a public health issue, which really changed hearts and minds. Ideally, what's going to happen is there's going to have to be a federal piece for the widespread adoption of this. But in Illinois, recently, in this last legislative session, the 102nd legislative session, Rep. Ford, LaShawn K. Ford, put forth HB 110, which essentially directed the Illinois Department of Human Service Substance Use Prevention and Recovery Division to begin the regulatory framework and actually even do a pilot of an overdose prevention site. He picked up 13 co-sponsors. When it needed to come out of the committee, Director David T. Jones from Super came and testified on behalf of it, which was really actually quite groundbreaking kind of piece for us. But the piece was heard, the bill was on the floor, and I think only got 42 out of the 60 votes that were needed. We were trying to get, now when I say we, a group called Illinois Harm Reduction and Recovery Coalition that is chaired by Chelsea Lalibert, who is from Live for Lolly out in the suburbs. And also we had a legislative committee from the task force that did a lot of work with reaching out to legislators, et cetera, et cetera. So we do need to have a regulatory framework for this and some buy-in. And I think that we also need a few other things. We really don't know officially where Cook County and the city are on this. We've not heard any kind of definitive information from the mayor's office or from the Cook County leadership. And that's important because one of the questions is, even though HB 110 didn't pass, can the city, the state begin to still create those regulatory framework without necessarily having a direction from the legislature? And I think yesterday in our task force meeting, David Jones said that they weren't going to abandon their efforts to really help clarify this moving forward. But in terms of really being able to do this in Illinois, we do need to pass something like this. I still think what we're looking at for this year is a lot more deeper conversation with some of the community. We're also looking at getting information from that group 18 to 30, which is probably a mishmash of different generations that I'm not really good at kind of articulating each one of them. But we need to know information from them and more deeper conversations with people who use drugs that may come out of the connection and the interaction with folks during our outreach events. Actually, we're hearing things bubbling up from the communities. Lou, you want to mention that long-term 20-year pair that really said, hey, we need something like this?
Yeah, I don't mind because I think we're closer to an OPS than people realize. When we are out there doing outreach, we have all the entities present a lot of time at a lot of the site, with the exception of the space where the sanctioned use is supervised. Other than that, we're out there, we have the organization with the MAS, the open wound care, we have counselors, we even have doctors on site at a lot of these places. So somehow I think what we need is someone to put it on paper and the powers to be that make the decisions come out and see actually what's happening. It's almost to fruition. It's just got to be put on paper and say, well, hey, educate the community a little bit more about what's happening, because the resources are there now. It's just not on paper. It's just not sanctioned. And we're getting good responses from some of the people who use, because they see it as a need. I was talking to a couple of people from one site, and they said, well, hey, we've been using for 20 years, and we are on heroin because we got on because of the pain. One guy was in a wheelchair, and we got some pretty good insight. They said you should have a place where it could be safer for us. At the time, I was out there to observe a comfort station in the area that's been closed for 20 years. They lock the washroom doors, no one can get in and out, yet the people are still using the facility as if it was open, and no one is cleaning it up. So something to me doesn't make sense there. So I think the powers to be, we need to get a few more of them to pat the pavement to actually see what's happening, instead of making a decision based on data that comes through. Sometime I question the data because it's 15 years old. I mean, 15 months old sometimes. But those are some of the things as an outreach director and outreach workers we see. And those are some of the things, I mean, we look forward to seeing night ministers. When we don't see them, we have their number. We call them for people that say, hey, where's night minister? So we get right on the horn and call them. And a lot of times, if they're not too busy, they'll show up. So we have this collective action going. It's just not on paper.
Right. Yeah, I mean, when we have a well-attended pop-up by the providers, we actually have kind of a de facto short-term OPS. I mean, we have people who could revive folks. We have the ancillary services there. But again, there's nothing official, and we really haven't come up with a model. And one of the pieces that Sue and her team are going to do is really kind of pick from the 100 plus sites out there in the world, and really see what the range is, what are some of the different models. I don't think any of it's going to be more ideas and insight into how they might be, especially as we try to talk to folks and how they visualize, in their heads about what would look.
Yeah.
What kind of questions? Go ahead, Lou.
And Lee, I think Chicago will have to be a special design project. I think we can gather all the information we can from Canada and the other sites that are in operation, but with all of the political climate in Chicago, this will have to be a special project where we'll have to have those people on board, and not on board just to be on board, with an understanding of the purpose and where this could go, that it really could save a lot of lives.
Yeah, exactly. What kind of questions do you all have?
I have one question real quick, and then I'll open it up to other folks. I always ask this question at every Lamplight lunch, but what can people do, right? So obviously we as an organization at the Night Ministry, I assume other folks on this call understand the importance of this work. In a lot of ways, we're already doing this work, but what can we do to help support the process of resourcing an OPS, or perhaps advocacy in terms of legislation and infrastructure?
Well,
Lee,
go ahead, Lou.
One thing that I always preach is give us 15 minutes of your time out on the streets with us at some of these sites, so you can observe and actually see. If you've never been, you would have a real understanding of what it takes and what's needed to address the problem. 15 minutes of street time with the outreach squad.
And in some ways, I'm sure we're preaching to the choir, because I know there's folks that do that, but I think it's still very important. We've had partners who have organizations right in the community that do treatment programs and counseling. Have a whole different picture when they step out of their building and kind of see what's going on. Legislatively, you know, I mentioned the Illinois Harm Reduction and Recovery Coalition, of which Stefan Karuba actually is our, I wouldn't call him secretary, the note taker. So he's been intricately involved in what the work from the statewide group is. And also the West Side Heroin Opioid Task Force has a legislative committee that pretty much was created out of around its HB 110. So, you know, we can keep you on if you want to do this, Brittany, put you on an email list so that when we get information out to the large community about what's going on, you can, you know, sign witness slips, identify perhaps if you have expert testimony. And when I say expert, I'm not leaving out, I'm really leaning towards the folks that Lou's working with. We have some very sharp, articulate, to the point people who a lot of folks wouldn't give the time of day. They could really step up and really talk about the realities out there. So I think that's important, and also just keep educated about this. And you know, I'm pretty sure that if not certain, that the Night Ministry, really one of the underpinnings, the key foundations is harm reduction and meeting people where they are, and harm reduction as an approach, not just one type of intervention for folks, but actually the real philosophical underpinning of how you work with people. I think that's something that's going to continue to be, you know, what we need to educate people on moving forward. It makes sense. It's humane. It gives people dignity. And I think that's really at the root of what the whole movement to OPSs are all about.
Yeah, and we have one-page fact sheets. We have in both English and Spanish. We have one version that targets the community in general, and then we have one that we developed for people who are using drugs. So, you know, we can certainly share those with you if you're interested in seeing those and getting copies to you, whatever you need, if you think that would be useful. I would also make a pitch for talking with your clients about what they think about an OPS and whether or not they would use it, because, you know, it's always surprised us with the survey results that, you know, so many of them are like, I'm not so sure this is a good thing. And we're trying to, as Lee said, we're going to do some more discussions with those folks in the coming year to kind of find out what is some of the reluctances. Is that they think they would be arrested? Is they think, you know, that it would be in a place that would be hard to get to. So any insights you can get from your clients, I think, is helpful as well, because again, we don't want to build something, put something in that people are reluctant to use.
I like that, Sue. And again, I think this whole issue centers around heroin and opioids. And if you look at, well, what's the driving force to do all of this? It would be those two things with the people that's using those opioids out there. So again, to piggyback on Sue, what better way to carry a message than to get more messages from those people out there and their opinion on the use of a facility. And we can bring you information as an outreach team, but I think, again, like Lee asked, how many of you been trained? My question is, how many of you have actually been to ground zero to one of those sites? Again, I think that is just equally important as being trained on how to use the kit to reverse an overdose. Actually, witnesses are seeing near overdoses, you have a better understanding. I just keep pushing for getting people out, Lee.
You know, and Lou's talking from experience. I mean, he's a long time, I don't want to speak for you, Lou, but, you know, 35 years, I guess we can speak for each other sometimes. But, you know, your eyes were open a couple of years ago just by going back into the community. I mean, going into the community you go into every day, but with a different perspective and seeing some new things for yourself. So,
yeah, true.
You know. So I just put the link into the House bill as it stood before the election. So, I mean, before the votes. So you can go to that and kind of take a look at it. If you haven't ever done witness slips, etc., that's something that you can get involved in. It's pretty easy to do. Even I could do it. So, we've talked a lot after. I'm interested in questions. I know
Hello.
it's your show, Brittany.
Hello, my name is Faith. Faith Miller. I think I put my information in there. I am the Outreach Services Manager. And I just wanted to speak to your question, Luther. You had asked how many people are trained. And technically our whole outreach staff, our bus, as well as the, all of our outreach staff are trained as far as harm reduction. So we all know what to do to reverse overdose. So that's kind of like a given for us. I think I've gone through it in the last 7 years. I've been pretty much trained on that. But I also just wanted to mention that I've heard about this. I went to one of our mobile health, help me now. It was a conference, and they actually spoke about this, and they actually showed a video where they had the structures where people could come and safely use their opioids or whatever drugs they had. So I guess back then, because that was probably about 6 years ago, maybe. Of course, I'm like, well, we're in Illinois, so I don't know what's going to happen. But it's good to hear that now that question, is being entertained, what about the structure? So let me know. I mean, if there's anything I can do, I'd be more than happy. I think I put no on the mailing list, but we can change that. We can edit that in if there's anything I could help with.
Great.
Okay, well, what's your name again?
Faith.
Faith, okay.
Miller.
Yeah, and to back up a little bit, yeah, I was piggybacking on Lee asking about how many people have been trained, in which the training is very, very grateful to have that knowledge and that in case you ever have to use it. But my push and my question was, a lot of people have been trained, but have they ever been out on a site in the street to see why and how you might have to use that training? Have been on Jackson, Pulaski, St. Louis and Lake, 63rd and this, that, and other,
Yeah, our street medicine team has been out there. They've actually saved several people already. So yeah, they've been there. They're doing it. We're doing it.
So Lee, like I said, preaching to the choir, but choir, if you already got it, you got it. But I'm preaching to the people that haven't been out and in offices and make decisions based on information they get. And sometimes I don't know if they get all of the right information to help design some of these projects. You understand where I'm coming from? Yeah, because there are a lot of people that make the decisions and make sure you're trained. They might not be trained and they might not come out, but they're the final one to say, well, okay, we'll help do this. You understand what I'm saying?
Right.
And I'll just interject there for a moment, because we have incredible outreach folks that are out there every day, but the majority of our staff that's working in an office never has been. And I know some of us have the opportunity to go out sometimes with street med, and that's something that I think everyone in our organization should have to do if we're, working on behalf of the organization, especially folks who are making decisions, right? Like you said, Lou, those who have the power to make the decisions in our organization should be able to see what it is we're doing and have a better understanding of that.
Thank you. Right. Because Sue, I think the team and some of the people in the community was really impressed about 6 or 8 months ago when you came and spent over an hour out there with us on Jackson and Pulaski. That meant a lot to us and to some of the people that we were working with, that you would do that. And you said, Lou, when I go back, I got to do something.
Yeah.
Because I don't know what you saw, but I was hoping you could see what I've seen.
Yes. Yes, and I need to go again, and I need to make my staff, have my staff go. I shouldn't say make, encourage my staff to go. But yeah, I mean, it informs the work we're doing, right? I mean, that's kind of been my personal mantra my entire career, the kind of research that I do. If I'm not willing to be out there on the ground and see what it is, you know, I've never been a fan of the ivory tower researchers who are like the guys sitting in the office making all the decisions, right? And saying, oh, this explains why we have blah, blah, blah. You got to be out there and see what's happening and talking to the people. And that's also why I'm encouraging, you know, if you're talking with your clients about that, and you're willing to share some of that with us, or as we have opportunities in this coming year to, you know, more listening sessions with people who are using drugs, that's really important for us too, to have that experience.
You know, thank you. There's a question here from Carrie about would participants be able to ingest their drugs in ways other than injection, like insufflation and snorting and smoking. You know, actually what we're finding is that West Siders, African Americans specifically, probably do not use needles as much as other cohorts. They're more in terms of snorting, and you know, that poses a, you know, a unique, you know, both in framing what we're there, but also in kind of connecting with really what's really the root of administration out there. So again, I don't think we've come up with a model per se. I know there's other drugs that are being used out there and smoked as well. And I think that's still a piece that we need to figure out. And I think that what we want to do is have an umbrella is like, how do we save lives? Right. And then begin to think, you know, where we put our resources without leaving anybody behind. So that's a very good question. Thank you.
That's a good comment, Lee, because being out there a lot, like I said, I'll be 75 in a few weeks and lived in Chicago most of those years. Being out there 1 week, I saw a different community than what I assumed I was living in. Because sometimes you drive past, you don't stop, you really don't see. And to find out another thing you mentioned, a lot of people don't know that a lot of the Blacks don't use the syringes or the needles, you know. You'd be surprised at the transit groups that's in the West Side area that use those needles. I mean, I just visited one site. As a matter of fact, I've been meeting with a few people to see what we can do about that site as far as cleaning it up, as far as safety. But most of those people, a lot of them are suburbanites and they became homeless and they stay in the area. A lot of them, you find a lot of the right near the L stop where they come in and use. But that's just a fact. And sometimes you can learn stuff when you're out there that you don't realize that's happening right under your nose a lot.
Mm-hmm.
Thanks, y'all. That's really helpful. Does anybody else have any questions? Feel free to put them in the chat or unmute yourself.
I didn't see. I hope we didn't keep you from. Well, there's some people that don't have their video on, so maybe they're noshing. I don't know.
I just had a quick question, and thank you so much for your presentation today. I know you had mentioned that there were people that could, people from Canada possibly that could give kind of their opinion of how it went. Is there a good resource you would suggest, like an online website or testimony, just to get some feedback without them being here in person?
We've got that link, right, Lou?
Yes.
Share the link. So we actually had last month, we had 4 people who run OPSs in Canada talk about their experience. So I think that's an excellent resource because you can hear right from them what that was like, and it's probably better than a website.
Oh, great. And that's, I'm sorry, where was that link?
Well, I'm going to have to get it to you.
I think Lee can probably send it to Smash, right?
Okay.
Yeah, I'll send it out in a follow-up email.
I have
Thank you.
two videos, one with the police and one with the group. And they answered our specific questions. I don't know why I can't find it, but I will get it to you. And then, the harmreduction.org probably is a good spot to just kind of take a look and kind of branch off for some of that. And Sue, I don't know if you want to, you could also forward smash the links.
Yeah, I can.
Reports.
Yep.
So
yeah, I can just send the reports and send our fact sheets. And Jenny, I think there is, I know a year ago, there is a website, I think, from a group in Seattle. So I'll try to look for that as well. But I would really, really recommend, our webinar that we did with the folks from Canada, because they're very honest and they showed pictures of what their different sites look like. Like one was a tent out in the park and another was, connected to an actual healthcare facility. And one was like a little cottage and back of the facility. So there's all different kinds of options to really be thinking about.
Thank you.
yeah, one's right next to a police department.
Oh yeah, I forgot about that one.
They had in a town of in a city of 86,000 people, they had 7 OPSs.
Wow.
Yeah, somehow I don't see our first OPS being next to a CPD station.
No, that's still a lot of work for us to do. To get CPS involved, CPD and the fire department.
Does anybody else have any questions for Lee, Sue, or Lou?
I'm sorry, I'm multitasking. I'm trying to find that, but I'll get it to you.
Yeah, no worries. I'll send a follow-up email to everyone who both attended and registered. So if there aren't any more questions, I just want to thank Lee, Sue, and Lou again for joining us, providing us with all of that information and expertise. This was really helpful, and the night ministry, I know, looks forward to continuing this work alongside of you, and we hope to be able to help in the process however we can.
Thank you.
Smash, I thank you for allowing me to speak to your team there. And I bring you greetings from the outreach team here at the task force.
Awesome. Thank you. We appreciate everything you're doing, Lou.
Thanks. And as a former outreach worker, or maybe I still am, hey, keep up.
You're doing all the things, Lee.
Yeah.
All right. Thank you, everyone. Enjoy the rest of your day.
Bye.
Bye.